So to get to Heri Hospital, how far do people travel?
I'm not sure because we have many remote areas in Tanzania, and some villages are far from the place we are, because we are close to the Burundi border, and some people are from Kagera region, Mpanda, Katavi region. Some come from Kigoma towns, and there are some other in Kigoma. We have different districts, which are most of them are very distant from this place. One of it is Kakongo. Kakongo is about 250 kilometers up to here. And Kibondo is 150 kilometers up to here. And Kasulo is 160 kilometers up to this place. In Kigoma, almost 60 kilometers are the same. People from here, we cannot estimate exactly how many can travel because we are saving people. We are saving people from different places because our service is very efficient, reliable, and quality.
Good.
So indeed, I cannot estimate the destination, but there is other places which are very remote. We even take care of the patient from Burundi, Congo. They come across the Lake Tanganyika lake and come to us for service, and some from Burundi because of our service.
So when someone gets sick or injured, how long do you think it would take them to get to the hospital?
Most of patients who have injuries, we almost have 4 to 6 hours from the original place of injury to this hospital. But we have experienced that some we have got from even 24 hours injury. We have already got them because some people have their cultivation farms from places where there is no transport. As we know, Tanzania, we are not very connected in transport everywhere. We have other remote places where people are going to make a cultivation, fishing, cutting woodens, but still this a problem because they cannot get transport immediately after injury. So you can find some people get injured within 24 hours, they come to us.
In Western Tanzania, how many people do you think don't go to the hospital because it is just too far away?
Yeah, many people are dying even in the village because of the poor infrastructure, roads, maybe rain season, maybe other obstacles, many obstacles. But it's not like no conflict like war, but this is infrastructures at all. But basically, that's how many people die in their homes because of lack of transport. We don't have a real statistic on that. But of course, there is many people who have difficulty in traveling, and not only the injured people, even the pregnant women. Some deliver on the way from home to the hospital or health facilities. Some women deliver at home because of poor transport. So it is a troublesome. So if you compare the statistic of in RCH, the clinics, you can see many women are delivered at home, or many women can deliver on the way to the hospital. This is the reason why is due to lack of transport. So even those people who die in the village, because the statistic cannot come directly to the hospital, it should be at least 0.1% of the regional population may have death in the village.
How prepared do you think common villagers are to treat basic injuries or major illnesses?
What is?
How prepared do you think villagers are to treat injuries or illnesses?
If there are many people they don't have much of the experience of treating injuries, and some they treat it locally, People sometimes are not very prepared because they don't have sufficient knowledge of how to care. Some people may worry about the consequence of the contamination of the blood. Some they don't have people working with them who had an experience. As previous, there were people called first aiders who can conduct the injuries, but nowadays they are very limited. So the knowledge of the people and preparation of these people who had injuries most of time is sometimes local made. Yeah, because some they can use unclean materials which can make contamination to the wound. They can have poor blood arrest, so the people come in complication sometimes. I have sometimes experienced people who had a tetanus infection because they use a local application which are not safe for the wound. And I remember last year and this year we had three cases of tetanus. So the community have very limited knowledge of care of the injuries and the poor preparation.
In most villages, how many medical professionals do you think there are? Trained medical professionals?
We know Tanzania is still a less developing country. We have some dispensaries, but we have limited workforce. We are limited staff. For example, the dispensary which should have at least 5 staff, you can find have only 2 staff. One clinical officer, one nurse, maybe nurse who are going to have already completed the course specifically for their training, but some of them, they are not trained. They are trained locally. This is called medical attendant. We have many of them taking care of the patient. And sometimes you can see that in dispensaries, you can have only 2 staff. But in the other circumstances, maybe there is people who are going on training, maybe seminars and others. The dispensary remains with nobody. So if patient come there, there is no care. So that's a problem involving people in our area.
So do you think that villagers would benefit from training in first aid, CPR, basic rescue, highly contagious disease control and containment, and nutrition?
Yeah, in the benefit of this rescue, CPR, and the life-saving method is very important in our Western Tanzania, Kigoma, Mwanza, and Banda Katavi. Why is it important? Because most of it saves life. If we have this training, it saves life. And the second, it prevent deformity and prevent death. And Tanzania is surrounded with many river, lakes, and the oceans. And the people are involved in fishing. Many people drowning in the water need very high expert people for rescue from drowning. And some people involve themselves in, we know Tanzania, we have many of these wild animals, like elephant, leopards, lions, and the crocodiles in the water. So people are being injured with these animals because we have a small catchment there for forest and animal reserves. So if we have these people trained for this rescue, CPR, and life-saving skills, it will benefit to save life. Most important.
Can you talk about the highly contagious disease control?
Of course, African, I think, is most likely places where there is people, where there is a very high infectious disease. That's why we have many communicable diseases, either from person to person animal to animal, from water source. Now we have poor water systems. We have maybe sometimes crowded with communicable disease. Especially nowadays, we have very contagious disease called the Ebola. Despite Tanzania, we have no case of Ebola up to date, no case reported. But we are almost close to Congo, Zaire, where the people have Ebola, despite they are trying to limit and prevent people from traveling from one country to another. But we are very in caution to see if we can avoid the contagious disease like Ebola to come in our country. But we have another contagious disease like measles, chicken pox, this as well cholera, still a disease around in Tanzania. We have some cases of, especially Tanzania will go on a national campaign on vaccination to this disease, but still it's a problem. So we need as well, we have a lot of diseases like even hepatitis. Hepatitis is still a problem. HIV is still a problem. So even though we have people who has to rescue and make CPR, we have to have a knowledge of how to handle the blood so that they cannot be themselves become contaminated, so that they can be safe. Because if you touch the blood, you don't know if you have bruises on your hand, and then you get blood, and you get infection like hepatitis and HIV and other diseases and syphilis.
How important do you think trainings like this would be in villages in Western Tanzania?
What?
How important would trainings like these be important? How important would they be in villages in West Tanzania?
This will be very important. Of course, it's very benefit. I see we told that we have less professionals in the villages. If we try to form the village rescue and those people have knowledge, the life saving will be very easy. The access to the health facilities will be very easy. Because if you have somebody who has knowledge, teaching other communities how to handle the risk factor involved, the dangers ahead, then the person can mobilize the community and take patient to the hospital immediately before reaching to the complication. So the training is very important. We need it very highly, especially to form this in the different villages, and involve the government, involve the district, involve the village leaders, involve everybody, so that can know what is going on, so that the life saving will be easy for them. It's very important, because we shall, even this pregnant woman, you can save them, because if they get delivered on the way, they may have lost blood, complication with delivery, so they will secure the children who are healthy, safe, and the woman are safe, so they have a happy nation, like we want to expect to do in the Millennium Challenges.
Do you have any other thoughts or comments that you would think are helpful to this?
Yeah, my comments and suggestion, not only comment but and suggestion, we can comment, but we don't know, we suggest as well, because everything is crucial. It depends on the financial crisis and how much we can handle the program. The program should be continuous. Yeah? You know, if you want to make a program, it should be sustainable, long-lasting. And we need to have to form a special team of youth. The youth who are motivated to the first aid in each village. Second, we need to have continuous education to rest of Western region. Continuous education to the Western region. We need to have a basic education, like what you want to do, basic education on how to handle the casualties. We need as well supplies. If you teach somebody, but you don't give supplies, like gloves, gauze, protective gowns. For example, you can deal with Ebola, you can deal with cholera. So we need a protective material. You need the lab goggles. You need iodine. You need plasters, adhesive plaster for dressing wound, bandage for arresting hemorrhage, and at least the first aid kit which are complete. So we need supplies. And at least we need maybe if somebody at work, and in order to be very much motivated, at least the amount of payment so that these people can go on training, and while they have motivating, so that they can go on with their activity happily. Yeah. And what I want to think is to form a center, to form a center of first aid training, which should be continuous. It should not last, because if it lasts, that means, of course, the project should go on to train many people, and to reach at least many villages as far as we can. And at least we can supply even like a uniform for those people, because nowadays if an accident happen, if you don't have any special uniform, they say, oh, maybe you want to steal things from property from the passengers. Okay, if you have got your uniform with identity, maybe you have your white coat, but you have a red cross on your coat, so they say this is a stuff for the first aid. And also, as I told you before, we need to form a health team, involve district officers involved in health services. We need to involve the tenancy leaders in the villages, village leaders, and as well as the district leaders, so that the project can be consistent and being supported by the Tanzania government. I think that is all about my suggestion and comment.
Okay, very good. Thank you very much. Is there anything else you'd like to add at the end?
Okay, I'm very happy for the interview, and I'm sure the project will go on. I'm expecting a lot of things from our donors. The one who you are going to them to ask the assistance, please, we need it very highly if you assist this man so that he can reach his goals. So of course we are very appreciating, and we thank you very much for your. I know this country is of the hardship, because transport going up and there. That's what is very trouble. So we are very happy because you come in Kigoma and see us in Kigoma, and you have a vision in Kigoma, objective, and we wish your objective to be met. Thank you.